Well-meaning friends don't know what they're talking about. Let me explain what I mean by that, okay? Plenty of friends have told me, just go get your knees done. You complain about it so much, just go do it. Oh yeah? Let me see you do it. They have good intentions. They want you to be better. They don't want you to go through pain. They don't want you to go through misery, okay? So they want you to take care of your knees and get it done with, okay? Well, I'm going to tell you that unless they've gone through it themselves, they don't know what they're talking about, okay? I mean, yes, it's true. Plenty of people have gone through a knee replacement. Plenty of people have come out of there with no problems. But others have had some problems, like for me, okay? Took me a long time. And I would say I had full intentions to be perfectly fine after 3 or 4 months. I mean, my original goal was to get the second knee done right after the first knee was done. You know, wait a few months and go and do it. But after going through it, I told myself, I'm not doing that other knee unless it absolutely needs to be done. All right. So here's another thing too. I know plenty of people have actually watched my earlier Russ is Right videos, but haven't watched recent ones. So I get a lot of comments like, are you doing okay now? I'm so sorry things are hurting for you. I hope it gets better for you soon. I mean, comments like that kind of tells me that they've only watched the first few episodes of Russ is Right, but they haven't seen recent ones. Yes, I'm doing better now, but man, it took me a long time to get there. Okay. So, you know, I'm over two years now. I'm what am I, 2 years, 3 months, something like that. Okay. So people are always curious, how well am I doing at this point? Well, yeah, I'm doing pretty decent, but it took me forever to get there. I went through a lot of pain to get there. You know, anyone who tells you it's not going to hurt, run the other way. Even if you have to crawl to get there the other way, get there the other way. All right. It's going to hurt. Yeah. I'm not going to sugarcoat it to anybody. You know, if anyone who asks me, you know, is it going to hurt? Yeah, it's going to hurt. But what you've got to be able to do is put it in your mindset that you can get through this, okay? And also put it in your mind that you might not be able to finish it in 3 or 4 months. It might take longer. I mean, even my own doctor told me that most people are finished in 3 or 4 months. What he didn't tell me is that some people take 2 years, right? So what you really need to know is that if you're lucky, several months down the road, you should be, I wouldn't say back to normal, but I would say functional, okay? If you're not so lucky, it could take you 2 years, okay? So prepare yourself for the long term. Don't look at it as it's going to be something quick like I did, all right? I figured I would be up and running again by, 3 or 4 months later, I'd get the next knee done, and then, my original plan was after a couple of months of this, maybe 6, 7 months, I'd go out on a cruise. That was my plan. Who would have thought that the pandemic would happen and nobody wants to go on the cruise? Okay, that's not true. There are people who do go on the cruise, but the whole point is this. Getting sidetracked here. It's going to take longer than you think. Yeah. I mean, even if they tell you 3 to 4 months, you're not 100% functional at 3 to 4 months. You're still going through some pain. You're still not, moving as quickly as possible. I mean, it's going to take a little bit of time. All right. Don't listen to everybody. Listen to yourself. If you have fears about it, yeah, that's kind of healthy. You got to know that it's going to take some effort. It's going to be a little bit of pain in there. Is it worth it on the long run? People ask me this too. They say, would you do it again? Now, if you only watched the first few episodes of Russ is Right, the answer would have been no, I would never do this again. Okay. But as you know, I've gotten a little bit better. And so I would say, yeah, I would do it again. Yeah, I would do it again in the hopes that I would get better. All right. And I know that the right knee eventually will have to be done. So I will be going through it again. I know it. It's just a matter of when that's going to happen. Okay. So yeah. All right. Should you listen to me? No, don't listen to me. You listen to yourself. Okay. You're the only one that's going to be able to tell you when it's time to do it. You have to be in the mental mindset that it's ready for you to go in and get your knees done. If you're not in that mindset, you're not ready to get it done because, yeah, it's going to hurt, all right? I'm not going to tell people it doesn't hurt because it does, all right? Now, we all have fears going in to get it done. All right, you won't feel it on the day of the surgery until after you wake up from a surgery. All right. Okay, they're gonna put an IV in you. A lot of people don't like it. I don't like that. Actually, I think of all the things, I don't like having an IV put into me. I don't like that needle sticking in me and just hanging there for a long time. That part I don't like. All right, but you're gonna get knocked out. You're not gonna feel it during the operation. They're gonna put a nerve block most likely on your leg, so you're not gonna feel anything happening down there. Yeah, you're not gonna feel it. I think they put a breathing tube down you too. Okay, so the thoughts of those things aren't pleasant, but that's the reality. That's what they're probably going to end up doing to you. But you're going to wait. The minute you go into the operating room, you're going to talk to the doctor. He's going to ask you some questions. He's going to ask you what knee you're going to be working on, or he's going to work on. They always ask you stuff like that. They ask you, why are you here? They ask you which leg is it that's going to be operated on. They want to make sure they don't do the wrong one. All right. And usually they will mark the leg anyways, so they'll tell the doctor this is the one that you're working on. Make sure you answer that question correctly, all right? And then they're going to do it, all right? And then the next thing you know, you're waking up, okay? So that's when you're going to start feeling some pressure. Yeah, and then as the anesthesia starts wearing off, you'll feel it at that point. And even on the same day, many of us are woken up and said, okay, get up, we're going to start walking. Yeah, the very same day. I know that I stayed overnight at the hospital, and the next morning they had me going up and down stairs. Not that I was able to do it well, let me say that, but they had you do it because they know that once they send you home, you're going to be going up and down stairs. If your bedroom is upstairs, you're going to be going up and down those stairs. Somebody's going to have to be there to help you, okay? Typically, they give you a belt to put around your waist, and that person's going to hold that belt to make sure you don't fall. All right, so the whole point is this. If you're not mentally ready for it, it's probably not the right time for you to go in for a knee replacement. You have to be in the right mindset to do it, but nobody should be the one to tell you to go do it. All right? Well-meaning friends want you to be better, but they don't know what they're talking about. If they haven't gone through it themselves, they have no clue. It's easy for them to tell you, just do it, everyone else does it, okay? Yeah, run the other way. If you can't run, crawl the other way, okay? Get yourself mentally prepared and then go in and do it, all right? So, yeah, I would do it again because I know that without it, I can't get better. Am I better now? Not 100%. But I will tell you that time heals the pain. I will say that I've forgotten a lot about the pain. All right. I mean, the pain was always on my mind until I started getting better. Then you start forgetting about that pain. I have to think hard to get to the point where I can remember how much pain I was in when they were pushing my knee or pushing my leg to bend my knee. Okay. That pain, I think, might have even been worse than the actual operation. And I went through 80 of those, right? Because the physical therapist pushes hard. So, but I kept going back, all right? Because I knew that if I keep going there as many times as I can, I'm just going to get better over time. So you need to get yourself in that mental mindset. For me, I used humor to get through it. I joked around as I was there. I joked around with the therapist. I joked around with the patients around me. That's how I got through it. But you've got to find something that will get you through that therapy session, get you through the operation, okay? And until you're ready for it, don't have anybody tell you that you have to go in to do it, all right? That's all I really wanted to say. Hopefully you guys got something out of it. Share it with your friends if they're going through a knee replacement. Let them know that, they have to be ready themselves. They can't just have someone tell them going in and do it, all right? You've got to have that mindset yourself, all right? If you like the video, hit the like button, hit the subscribe button, and I'll talk to you guys next time.